Okay. Hello, my name is Jacqueline Clark, and I'm going to do a head-to-toe assessment on you today, if that's okay with you.
Yes.
Okay. Can you tell me your name?
JD8,
Okay. And what's the date?
July 8, 2017,
And where are you today?
Ocean Harbor, Florida.
All right. And who's the President of the United States?
President Donald Trump.
Nice to meet you.
Nice to meet you.
So go ahead and, if you don't mind, please count from 0 to 32 by force.
0, 4, 8, 12, 16, 20, 24, 28, 32.
And then count from 21 back down to 0 by 3.
21, 18, 16, 12, 9, 6, 3, 0.
Okay, very good. So first, I'm going to assess your hair, skin, and nails. So I'm looking at the skin, and I don't see any, it looks symmetrical. I don't see any red areas, lesions, rashes. Looks good. I'm going to palpate your skin for temperature and dryness, which your skin's warm and dry. And I'm going to palpate also for texture. I don't feel any masses. I don't feel any lesions. And I'm also going to check skin turgor, which she's got good skin turgor. Okay, and I'm going to assess then your nails. Nails are short, they're clean. I don't see any crevices or ridges upon palpation. They're smooth and in good health. Checking for capillary refill in less than 3 seconds. And I'll check for clubbing. So can you put your nail beds together for me, please? And let me see, and there's a space in between, so there's no clubbing. I'm also going to check capillary refill of the feet. And the toes and nails look good on the feet. Now I'm going to move on to head, neck, and face. For head, I don't see any deformities of the head itself. I'm going to palpate the head. And her head is freely movable. Very nice your hair. And I'm also going to palpate her hair. It's soft. It's good quality. I don't see any dandruff. I don't see any balding areas. All right, and then I'm going to check for the face, symmetry of the face. Eyebrows are even, eyelashes. Eyes even, ears are even, nose is midline, mouth is good. So now I'm going to palpate the face, the frontal sinuses. Is any of this hurt?
No.
The maxillary sinuses. And then I'm going to test temporomandibular joint. And can you go ahead and open your mouth? And I hear some clicking on the right. I'm also going to assess the trigeminal nerve for the masseter muscle. So can you go ahead and clench for me? Good. I can feel that. I'm also going to test sensation of the face. So like a cotton ball. I just close your eyes and let me know if you can feel it. When you feel it, just say yes. Okay?
Yes. 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 Yes.
Okay, good. And then I'm also going to test for facial nerves. For facial nerves, can you smile? Frown? Surprised? Okay. Whistle or blow me a kiss? Okay. And then I'm going to have you puff your cheeks out, and I'm going to test your cheeks, which you can keep the air in. And I'm going to have you close your eyes, and don't let me open them, okay? Okay, good. So now we're moving on to the neck. I look at the neck. I don't see any jugular distension, vein distension. Looks good, symmetrical. Trachea looks midline. I'm going to palpate the trachea. Okay, let me know if this hurts. Okay, and its trachea is good, down the middle. I'm also going to assess for tracheal tug. And I don't feel anything when you swallow. I can feel. So now I'm going to assess the thyroid. So if you could take a sip of water and hold it in your mouth, please. You got it there?
Mm-hmm.
Okay. So to assess shaky a little bit. Turn your head slightly to that side and go ahead and swallow. Good. And I don't feel anything. I don't feel the thyroid, so it's not enlarged. Go ahead and take another sip of water. And I'm going to assess the other side, palpate the other side. So turn your head slightly to the right. My fingers here. Push the trachea slightly over and go ahead. Sorry, I know that's uncomfortable. All right. And after the thyroid, I'm going to assess the lymph nodes, palpate the lymph nodes. So there's 9 lymph nodes. We have occipital back here, periauricular, postauricular, periauricular, tonsillar, excuse me, submandibular, and submental. We're going to do behind the sternocleidomastoid clinoid is the post-cervical, anterior cervical, and then supraclavicular. Okay. So upon assessment of the neck, I'd like for you to turn your head, the spinal accessory nerve, like you turn your head to the right, turn your head back, turn your head to the left, turn it back, and then go ahead and shrug your shoulders. Okay, good. Now I'd like for you to do this with resistance, so trying to move my hand with your face. Good. On the other side. Good. And then I'm going to push on your shoulders, shrug your shoulders. Good. Eyes, ears, nose, and throat are next. I'm looking at her eyes. They're symmetrical. Her eyebrows are good quality and look healthy. Her eyelashes, she's got eyelashes. Eyelids look good. I do see that her pupils are probably about a 3, and they're symmetrical. Her irises are blue, sclera is white. I'm going to lower just a little bit so I can check conjunctiva, and her conjunctiva is pink. I'm going to palpate the periorbital space and her eyebrows. They are good quality. And I don't feel any bony promises or anything. Palpation feels symmetrical. So at this point, do you wear glasses?
Yes.
But you have your contacts in?
Yes.
Okay, good. So we're going to test your functional vision. So I've got this card here. Cover one eye. And go ahead and read at a safe, comfortable reading distance where you would read from. Go ahead and read the last line.
LTFTH.
That you can read. Okay, very good. And cover your other eye at a comfortable reading distance.
LTFTH.
Okay, very good. I'm also going to have you cover one eye. We're going to do cover uncover test. And this is checking for balance. Go ahead and uncover. And her eye did not bounce around. Go ahead and cover the other eye. And uncover. Okay, good. That was to check for balance. And the corneal reflex is also to test for balance. So, and it's shining perfectly in both eyes. Also for the vision test, the functional vision, I am going to have you do peripheral testing. So cover one eye and follow my fingers and tell me when, or actually look straight ahead and let me know when you see them wiggling.
Yes.
Okay?
Yes.
Okay?
Yes.
Okay?
Yes.
Okay, cover the other eye.
Yes.
Okay?
Yes.
Okay?
Yes. Yes.
Okay. And then we're going to do the 6 cardinal fields of gaze to test for coordination. So look straight ahead at me. And right at my face, you can. Okay. And follow my finger with just your eyes, don't move your head. Now go ahead and look at my finger. And I'm also going to test for lid lag. So look up, follow my finger, follow my finger down, which she doesn't have any lid lag. So the eyes, ears. I'm looking at the ears and I don't see any lesions behind the ears. Everything looks good. Palpate the ears. Don't mind. All right. And on palpation, I don't feel anything. Was it tender? Did it hurt? No. Okay. Let me know if anything does. And now we're going to do a hearing test. So cover one ear. Repeat after me what I whisper. The whisper test. So, and cover the other ear. Very good. So now I'm going to test for sound lateralization. So I'm going to hit this, and you tell me if you hear it equally in both ears. I'm going to place it right on top of your head, okay?
Okay. Yes.
Okay. And that is the Weber test. Now for the Renee test, it's air-to-bone conduction. So I'm going to place it back here. Tell me when you're done hearing it, okay?
Okay.
Okay. And we're going to do it by your ear. Same thing. Let me know when you can't hear it anymore.
Okay.
All right. And same thing on the other side.
Okay. Okay.
Okay. And so that's for the ears. The nose, I'm going to look at the nose, inspect the nose. It looks midline. I don't see any deviation. I'm going to palpate the nose right at the bridge, okay? And I don't feel anything bony prominences one way or another. It feels straight and symmetrical. I'm going to look up in your nose. And the mucosa looks good. I don't see any drainage, and I don't see any obstruction of either nerve. Okay, for the mouth, I'm looking at her lips. They're not dry. They're not cracked. Okay, go ahead and open your mouth. Okay. And stick your tongue. I'm looking. Do you have your tonsils?
Yes.
Okay. And I don't see them, so probably grade them a 1. And stick your tongue up. Okay, good. The floor is good. The teeth are all intact. You can put your tongue back down. Open your mouth. I don't see any missing teeth. They're not chipped or broken. The roof of her mouth is pink. Don't see any lesions or anything in there. So I'm going to have you stick your tongue out again and say, ah. And her uvula rises and falls symmetrically on the sides. Excuse me. So now I'm going to have you stick your tongue out and straight out. Move it side to side. Okay, good. And I'm going to, when you stick your tongue out this side, snag your tongue with a gauze so I can look at the sides of the tongue and the base of the tongue. Okay, ready? Go ahead. And I'm looking over. Sides of the tongue look good. The base, I don't see any lesions. Okay, very good. Thank you. Good. So now I'm moving on to chest. I'm looking at contour, symmetry. I'm seeing her chest rise and fall evenly. Her respiratory rate and rhythm is smooth and good. So I'm now going to palpate the chest in a Greek E pattern over the intercostal spaces or the air-filled spaces. Sorry. And then lateral. I'm also going to inspect the AP diameter on both sides. So I'm now going to, after palpating the chest, I'm going to auscultate the anterior chest. Over the air-filled spaces. Yep, just breathe nice and slow, good through in and out through your nose. Okay, you can lift up. Good. Okay, good. So now if you could turn around on the bed. Actually turn a little bit more this way. Perfect. And raise your shirt. You don't mind? Perfect. Okay. So looking at the posterior chest, I don't see any retractions like the front. I don't see any use of her accessory muscles to breathe. Respiratory rate is regular. So now I'm going to palpate posterior in the Greek E pattern over the air-filled spaces. Oops. Here. And I don't feel any masses. Is that tender at all?
No.
Okay. All right. Also going to percuss over the air-filled spaces. So you're going to feel me tap. Let me know if this hurts. I'm testing for resonance. And I can hear that. Okay, good. I'm also going to feel for tactile fremitus. So I'm going to place my hands on each side of her back and go ahead and say the words 99 over again.
99.
And I can feel vibration.
99.
Yep.
99. 99.
Good. And now I'm going to do thoracic expansion. So I'm going to place my fingers together. Go ahead and take a deep breath. And my fingers separate symmetrically. You can let it out. So I'm going to auscultate. Okay. And then I'm going to check the costovertebral angle. So this is actually going to test for kidney inflammation, but since we're on the back, we're going to do this now. So costovertebral angle here, and I'm going to give you a thumb. Let me know if there's any tenderness, okay? Okay, same thing over here. Okay, very good. So next I'm going to have you turn around. Actually, you can lay down for this, I'm sorry. So I'm assessing the heart at this point. the heart, there are the areas of the heart that I'm assessing would be on the right side, right, since second intercostal space, right sternal border, lateral border is the aortic area. Pulmonic is second intercostal space. On the left sternal border area, third intercostal space on the left sternal border is the pulmonic, second pulmonic or Erb's point. In fourth intercostal space, left sternal border is the tricuspid area. And then fifth intercostal space, right over here, is the mitral area, and it's also the point of maximum impulse. And so those are the areas I'll be testing. Upon inspection, I don't see any heaves, I don't see any lifts, I don't see any vibrations or anything in her chest. So now I'm going to palpate, I guess I'll palpate in the chest area, aortic, mitral, aortic, pulmonic, second pulmonic or Erb's point, and then tricuspid. Any of this hurt?
No.
Okay. And mitral valve. And here, I can feel a little bit of a pulse, a rhythm. And now I'm going to auscultate the heart sounds. If I were to hear anything abnormal upon auscultating heart sounds, I would test also for agaphony, bronchophony, and whispered pectocloquy. And I would also have her either sit up and lean forward or lay on her left lateral side, where I would be able to hear the heart better against the chest wall. At this point, too, I'd like to just mention that the tricuspid and mitral valve closures is the sound of S1, and the sound of S2 is the aortic and pulmonic valve closures. If I were to hear systolic murmur, I'd hear a systolic murmur after S1, and if I were to hear a diastolic murmur, I'd hear diastolic murmur after S2. I'm going to go ahead and listen. With the diaphragm, aortic, pulmonic, second pulmonic, tricuspid, and mitral. Good. Now with the bell, second pulmonic, tricuspid, and mitral. Okay, very good. So while I have my stethoscope, I'm also going to listen to her temporal and carotid arteries. Sorry. Carotid. Good. So I'm going to palpate the temporal arteries, carotid arteries, and then the rest of your arteries in your extremities. So, carotid, those are the temporals. Now I'm doing the carotid arteries. I'm going to palpate the brachial arteries and the radial. Okay, and then the popliteal. Yep, thank you. And my down. Okay, and I'm going to dorsalis pedis, which is the top of the foot. I don't know if you can see that from there. And posterior tibialis is back behind the ankle bone on the interior portion of her foot. And while she's laying here, I'm going to assess the abdomen. I'm looking at the abdomen. I don't see any peristalsis. I don't see any extra movements. So that's good. So I'm going to auscultate the abdomen. Gurgling. In all 4 quadrants, I'm going to listen to her abdomen. Good. Okay, good. So I'm now going to palpate lightly the abdomen. And let me know if any of this hurts, because I don't want to do a deeper palpation. And I don't feel any masses or anything as I'm palpating. Okay. And I'm going to palpate deeper, if that's okay.
Yeah.
Okay. In all 4 quadrants. Okay, good. And so now I'm going to percuss the abdomen. So let's see. And I can hear timpani when I percuss. And so now I'm going to feel for her liver, her right liver. So I'm going to do a hooking method where I'm going to put my hands right here. I'm going to have you take a deep breath, and then when you take a deep breath, I'm going to push down. Okay, go ahead, take a deep breath. Okay, and I don't feel. Go ahead and release. So now I'm going to check the kidneys. I already assessed the kidneys for the costovertebral. You're good. You can flat back. Oh, sorry, my hands are all costovertebral angle already, but I'm going to try to see if I can palpate the kidneys. So for the right kidney, I'm going to have you take a deep breath. Okay, and I push. Oops, sorry, push down, and I can't capture the kidney, which is good. It's not showing any inflammation, and I'll do the same thing on the other side. Okay, and go ahead, take a deep breath. And I can't capture the kidney, so good. All right, so that's the abdomen. Now, while I have you laying here, we're moving on to musculoskeletal, but I want to assess the hips. So go ahead for me, and if you could lift your leg up slightly and move it straight out, away. Here, I'll kind of help you. So that is abduction, and adduction, we're going to move it in and across. So abduction, we're going to lift this leg and move it out. Abduction, bring it across. Okay, good. Now for flexion and extension of the hip, can you raise your leg up to your chest, knee to chest? Good. And back down. That's flexion. Now extension. Same thing with the other leg. Flexion, extension. Now I'm going to have you do that with resistance to test the strength of the hip. Go ahead and bring your leg up. And don't let me push you down. Push back on me. Good. And then don't let me pull. Good. Same thing with the other leg. Don't let me push you towards you. Good. And don't let me pull. Okay, good. And so now I'm going to test also for range of motion, internal rotation. So if you could put your heel on your heel next to your knee. It's okay. And rotate your knee that way. Good. Now straighten your leg out. Same thing with the other side. Internal rotation. Good. Back out. Now for external rotation, put your heel on the knee. Yep. And then let your knee fall out. Okay, good. That's external rotation. Same thing on the other side. Good. External rotation of the hip. And we did the strength of the hip. So at this point, you can go ahead and sit up, and you can pull your shirt down. Thank you. So now I'm going to assess the neck, strength of the neck. So can you turn your head to the right? This is rotation of the neck. Right, very good. Now flexion of the neck, and a hyperextension of the neck would be back, and lateral bending of the neck. Put your ear to your shoulder, ear to your shoulder. Okay, very good. And then we're going to test the strength of the neck. So don't let me push your head backwards. Good. And don't let me push your head forwards. Good. So for shoulders, I'm going to have you do abduction of the shoulder. So raise your arms above your head. Okay. And then adduction, cross them down in front of you. Okay, good. And internal rotation, can you take your hands and put them behind your back? All right. And external rotation, have you put your hands behind your head. Very good. Now we're going to test the strength of the shoulders. So if you put your arms out beside you. Don't let me push your arms down. Good. Don't let me push your arms up. Good. Okay. So elbows. So we're going to test elbows. Have you put your arms out in front of you. Okay. And straight out, that's extension. Bring them back in. That's flexion. Put your arms out again. This is supination. Can you turn them over? Pronation. Supination. Good. So to test the strength of the elbows, can you put your elbows out in front of you? Okay, and I'm going to pull. Don't let me pull. Don't let me push. Good. Now we're going to move to the wrists and hands. Put your arms straight out in front of you. And flexion of the wrists will be down. Hyperextension, up. Good. Now we're just going to do flexion of the fingers. Flexion and extension. Good. And then to test for hand strength, I'm just going to have you go like this and squeeze my hands. Okay, very good. So that's strength of the fingers and wrists. Moving on to the knees. Can you extend your knee? You're one at a time. It's fine. It's okay. That's extension. Back down flexion. The leg extension. Back down flexion. Now for strength of the knee joints, I'm going to have you push against me. Very good. And pull back. Okay, very good. And then I'm going to test for ankle range of motion. So dorsiflexion would be toes up, plantar flexion, toes down. Okay, and we also need to test for eversion, if you could put your heels to get up, and inversion, twist them, yeah, okay. And so to test the strength of the feet, try to pull your toes up, very good. Try to push your toes down, very good. All right, and what I did not verbalize is when she was laying down in the bed before we did the hip, I was inspecting her joints and I did not see any redness. I don't see any joint deformities. They all look symmetrical when I look at them together. Musculoskeletal is even and good muscles. So now I'm going to test the vertebral column and hip hyperextension. So if you could go ahead and stand up. Thank you. And for flexion, I need you to, of the spinal column, go ahead and, vertebral column, go ahead and touch your toes. That's flexion. Excuse me, now stand up. And then hyperextension would be the lean back. All right. And can you rotate your trunk, leaving your hips forward? Rotate. Very good. And then lateral bending, one side to the other. Very good. We don't test strength of the vertebral column. At this point, we're going to test hyperflexion of the hip. So if you could just turn sideways, I don't want you to kick the bed. Okay, and go ahead and extend your foot, right foot behind you. Point. Very good. And back. And now the left. And back. Okay. And then you can go ahead and sit down again. So now I'm going to test for neurological. So part of the exam. So I'm going to test for superficial touch, superficial pain, and superficial vibration. So for superficial touch, I'm going to get my cotton ball with your eyes closed, open. See what this feels like?
Yes.
Okay, so let me know when I touch you with it. Just say yes, okay?
Okay.
Now close your eyes. Tell me when you feel it.
Yes. 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 Yes.
yes, 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 yes. Okay, good. So superficial pain this is the dull size. This is what it feels like with your eyes open. And this is sharp. Okay. So tell me just say dull or sharp with your eyes closed when you feel it, okay? Dull. There. Dull. Okay. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Okay, very good. So now I'm going to feel for vibrations. So on your joints. So let me know when you hear the vibrations. Just say yes. 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 Okay, and the lower extremities. Yes. 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 Just on the bony prominences is where we test for this. So now I'm going to test for discrimination. So we have stereography. So I'm going to put two objects in your hands, have you close your eyes. You got to tell me what they are, okay? Okay. Close your eyes. So these are the two objects. Okay. And go ahead. Oh, sorry, one at a time. I don't want to confuse you, right? Good. And the other object? Yep. Very good. So with your eyes closed, I'm also going to test for graphesthesia. So palms out. And I'm going to draw a number on your hand. You let me know what that number is. Okay. 4. Okay. And on this side? 2. Okay. Very good. So neurological. So at this point I'll test for deep tendon reflexes. So I'm going to test the bicep area. So this has to be resting on something. So just go ahead and with your arm bent like that. Actually rest it like that. Okay. And I'm going to, what am I doing? All right. Let me push your arm back a little bit more. Very good. And see if I'm going to hit it with the point. Relax your arm. And it moves a little bit. Same thing on the other side. I know it's kind of hard to see, but it did this. Okay. I didn't really show much. And then for the triceps, you go back here. Let your arm dangle. Okay. A little bit. Okay. Did it a little bit. Supposed to do a lateral extension. And for the brachial, she doesn't have many reflexes though. For the brachial rate, I'll go ahead and just relax it on my arm. And I'm going to hit right here and see. A little flinch. And we'll do it like this so the camera can see. Relax your arm on mine. And relax your hand. And that one did. So then we'll do patellar. This is in the knee. Moved a little bit. And then we'll do Achilles tendon reflex. So I'm going to lift her foot. And I didn't really feel her push down much, but she's already told me she doesn't have very good reflexes. That one moved a little bit. Helped us a little bit. All right. And now I'm going to test for balance. So sit there. How much time? 1 minute. Test for balance. I'm going to push on the sternum. Okay, good. Now it's been 40 minutes exactly. I'm going to quickly look at my notes, see what I have missed, and try to finish the rest of my neurological exam and what I missed up till now. So, all right. Just checking the time. Okay. I'm going to start back up again. For the eyes, I did miss pupillary response, so I am going to shine the light in the one eye and look and see if the pupil constricts. And it does. Now I'm going to look for consensual, and the other pupil constricts. Same thing here. With one eye, her left pupil just constricted. Now I'm going to look at consensual, and her right pupil just constricted. Okay. And also, I'm going to do a test for accommodation of the eye. So I want you to look far off the panda, and go ahead and look at my finger then. Okay, and her eyes constricted slightly upon looking at a closer object from far to close. Back to the one more thing in the cardiovascular, the heart part of the test. I did want to mention that the maximum point of impulse is the mitral area, which is the fifth intercostal space left of the midclavicular line. I just want to make sure I made it sense that it was left midclavicular line. Okay, so for the rest of the test for neurological, we're going to do coordination. So I'd like you to do finger to nose, nose to finger, okay? Put your arms out, finger to nose, back and forth. Close your eyes and go faster and faster. Okay, good. And then put your nose on your finger, finger on your nose, and then touch my finger. Back to your nose, and my finger will be moving. Back to your nose, back to your nose. Okay, I also want to do joint position. Close your eyes because this was another discrimination. I'm going to have your hands, and you tell me if I'm doing your joints up or down.
Up, down.
Okay.
Up, down.
All right.
Up, down, down.
Okay. And to test further for the balance, I know I did the sternal nudge before we took the break. I'm going to test for Romberg. So go ahead and stand up, please. 10 minutes. All right. Close your arms to by your side, feet together, and close your eyes and try to maintain balance. Very good. Now go ahead and walk from here to the end of the bed, regular walk and back. Good. And walk backwards. Now do a tandem walk with heel toes. Good. Sobriety test. And back. And then walk on your tiptoes to the end. Good balance and coordination. Turn around and heel. Oh, sorry, toes back. And then heel. Turn around. And that's it. Thank you for participating in the examination with me.
Thank you.